I am honored and delighted to introduce Brad Talbutt, and Brad is a SHIBA coordinator. And SHIBA is the Senior Health Insurance Benefits Advisors, and the SHIBA program is a division of the Consumer Affairs Bureau of the Idaho Department of Insurance. As a SHIBA coordinator, Brad is both a Medicare counselor and a manager of the volunteers that the program employs. Brad has been with the SHIBA program for 6 years, and during that time, he has helped more than 3,000 people with their Medicare questions and problems. So I am delighted to welcome Brad. And Brad, thank you so much for sharing your time, your expertise, and the wonderful resources that SHIBA has to offer. And I'm going to turn it over to you.
Okay, thank you, Mary, and thank you, Dara, for the invitation. I'm really glad to be here and learn about Learn and your programs. I'm anxious to maybe take part more in the future. I'm Brad Talbutt with the Idaho Department of Insurance. SHIBA is a program administered by the Department of Insurance. It's one of the oldest in the country. Idaho actually started its SHIBA program after a year after Washington, which was the first program. It's been around for more than 35 years now. And so there are SHIBA or SHIP programs in every state since then. And we're glad to connect folks with those programs if they're moving from Idaho to another state. More common anymore that folks are moving to Idaho from other states, and we can talk about those complications if you have any questions about that here in a few moments. So what does SHIBA, what kind of services do we provide at SHIBA? We are, as Mary said, Medicare counselors by and large. We're also case managers, problem solvers. We conduct community education programs, mostly online these days or over the phone, but also in person and community forums at libraries and senior centers and anywhere else folks gather who have questions about Medicare. We do one-on-one Medicare counseling all day, every day. Again, mostly on the phone these days, but we do meet in person when necessary for folks who have questions and struggle to communicate over the phone or in this manner. In addition to those one-on-one sessions where folks are just asking general questions and getting specific information about what plans are going to work out best for them and when to enroll and how to do that and those kind of questions. We also assist with very complex Medicare issues, things like disputes over denials of service or denials of payment, things like enrollments that have gone awry, and other situations. So we interact with folks at the various Medicare plans, with CMS itself, with Medicare, Social Security, and directly with agents and other folks who are involved and may be involved with billing and providing services for our seniors, for Medicare beneficiaries. So the preponderance of our referrals come from two sources, and in fact, or I'd say three sources: Social Security, the Department of Health and Welfare. Probably 60 to 70% of our clients, our callers, are or may be eligible for Medicaid as well as Medicare or some other program to assist with their medical expenses. We screen almost everyone for those programs to make sure that the folks are getting all the benefits that they're entitled to. And we help with lots of these other questions. So when someone calls, they're going to get screened for several things. One, are they working and continuing to work, in which case they may not need Medicare at that point. We're also going to screen for Medicaid or Medicare savings programs and the Extra Help program. Make sure that if they are eligible or may be eligible, that we get an application in for them so that they can qualify for those really important benefits. So we have, is it 10? I think it's only 8 paid staff members at the moment in 3 regional offices statewide, Coeur d'Alene, Pocatello, and Boise. In addition to our staff members who are not only certified Medicare counselors, but also volunteer coordinators who recruit and train volunteers to become Medicare counselors. That's how we do this. So there are over 350,000 Medicare beneficiaries now in Idaho. Obviously, the 8 of us can't serve those people by ourselves. So we do recruit and train volunteers on a continuous basis. And this is the big hint portion of my presentation. If any of you are interested in learning more about Medicare and becoming a Medicare subject matter expert, we would be more than happy to help you out with that. Even if you don't become a volunteer with SHIBA, we're more than happy to get you certified so that there are more people who know what they're talking about out there. If you've ever dealt with Medicare, you know that it is a pretty good program, but a ridiculously complicated program when a problem arises. So that's how we do it. Our volunteers typically take between 3 and 6 months to become trained and before they're allowed to counsel on their own. Some take longer, some do it a little shorter, but that would be the average, that 3 to 6 month average. And at that point, they begin talking to folks one-on-one. Mostly on the phone, but we have started taking a few in-person appointments on a very restricted basis due to the virus over the last 1.5 years. So I'm not sure if that will change sometime soon, but that's what we're doing now. So we currently have just over 100 volunteers statewide. That number is down significantly. Frankly, lots of volunteers made the choice once the virus hit to withdraw. Others just weren't comfortable using their personal phones or counseling over the phone. It is a lot more difficult to do than it is in person. And so we've had, like anybody else employing people, we've struggled to maintain our numbers. So we're down about 35 to 40% in our numbers. So as we're approaching open enrollment, we are really girding ourselves for a very busy season. Most of you probably are aware that the annual enrollment period for Medicare begins on October 15th and lasts through December 7th. It's a little like being an accountant at tax time for us. The calls come in nonstop, and we're here usually 10 to 12 hours a day until it's over. So skip through the parts I've already covered. So we do have volunteers who work in a variety of jobs for us, all involved with solving Medicare problems and answering questions. There are most of our folks who are strictly Medicare counselors who are screening people, making sure we understand what their questions and problems may be, and then helping to resolve those. And we have caseworkers who really dig into more complicated cases that are going to involve interacting with providers, carriers, possibly even Social Security or Medicare to resolve disputes, help to file appeals or grievances, and make sure that those don't get lost in between.